Hi everybody, I am being joined by Dr. Christos from IVF Spain today. Dr. Christos Roukoudis, who will be answering any questions that you have. There are no such thing as silly questions, especially when it comes to fertility. I had so many. We just had a problem connecting, so I'm going to try and invite him in now. Let's see. Have your questions ready? Connect now. Hello to those who are joining. This is going to be a great session. We're going to be answering all your questions live, and they've also, IVF Spain have written for us, answering some common myths or common questions that people Google, which you guys have sent in as well. So we'll run through those. There we are. Hello, welcome.
Hello, hello. Hello, Louise.
Nice to meet you.
Nice to meet you. Thank you for having me.
Pleasure. Please can you start by introducing yourself and tell us a little bit about IVF Spain, and then we can start answering some of these common misconceptions and questions that people might feel are silly questions when really there are no silly questions when it comes to fertility.
It's true. My name is Dr. Chris. I'm one of the gynecologists here in IVF Spain, Alicante.
Mm-hmm.
Here's the main center of IVF Spain or IVF Live. We have clinics around the globe. So we have clinics in Spain, we have clinics in Germany, also in the UK. And regarding my person, I'm a gynecologist. I'm from Greece. I grew up in Germany, and now I live and work in Alicante.
Very nice.
In the location here in Alicante.
Very nice. Thank you for that. And so I'm going to start by asking you some of the questions because the experts at IVF Spain have answered some of our questions in an article this week, which I'm going to link up to this video, which is really just every kind of question that people might find embarrassing to ask answered, and that ranges from medical questions to lifestyle questions. So if people watching have anything that they would like to ask Dr. Chris, then please do, if that's okay. The first one we have is around obesity and infertility. Is that a cause for infertility? Are they connected?
It plays for sure a role. It's not like that obesity is like 100% a reason, but could be a reason that a woman is not getting pregnant. So for sure, it's not a 100% thing, but it plays a role. It has an influence into the ovulation because we know that the fat cells produce estrogens, and those estrogens can be an obstacle for ovulation in the end. So this plays a role for sure, and also through other mechanisms. They affect the implantation, and not only in women, also for us guys, obesity has also an impact to the sperm quality.
Okay. So when you see patients who might have a higher BMI, do you advise that they try and lose weight? What's the approach normally, and how much does BMI matter, for example?
It plays a role, but as I said, it's not like 100% thing. It plays a role, of course, not only not only if we speak about fertility treatment. In general, a healthy lifestyle, a healthy diet is crucial because it's not only the thing that you get pregnant, or it's also to stay pregnant, and also to support them and give your children the right information how to eat, what diet it should follow, because we see that obesity is a huge thing that affects not only our health but also our mental health.
Mm-hmm. Well, that was one of the questions actually. How much does diet impact your fertility? And when you see patients who might be doing different types of treatment protocol, does it what they're eating and what they're drinking or not eating or not drinking, or what they're taking in terms of supplements?
It's quite important. It's really important that the diet is balanced. So I rather used to say I'm not a friend of diets at all. So if I use the term diet, I mean that you should have like uh, to take all the necessary nutrition to support the needs of your body.
Mm-hmm.
So the Mediterranean diet is, for example, a diet that include fish, include many vegetables, a low amount of red meat, and it's a balanced diet.
Yeah.
So it's important. Now, regarding alcohol, of course, it's something that should be avoided for the male part or also for the female part, because we know that it has a strong impact. There are several studies that also support this claim. And we know also that besides of the fact that it has an influence of getting pregnant, we know how toxic alcohol is, and the long-term effects to an embryo are huge.
Right.
And it affects the growth of the embryo, of the baby. And also we know that people where mothers drank during the pregnancy, were drinking during the pregnancy, have issues with mental issues, have issues of being vulnerable to alcohol for themselves.
Mm-hmm.
So it's a huge thing, and something that I used to say is not to drink at all during the pregnancy, and to start even before.
Okay. Yeah. So obviously being in Spain and the Mediterranean diet, for people who are coming over to have treatment with you abroad, let's say, that's a very attractive thing to be having those kinds of foods and that vitamin D and everything else to go with it. Is that right?
Yes, and also I'm very happy that we can support our patients also with some nutrition consultation. We have a dietist in our clinic that can give the couples the right directions,
Mm-hmm.
because as I said, we try to accompany our patients not only during our treatment here, but also afterwards. And nutrition, as I said, is a crucial part.
Mm-hmm. Fantastic. And on kind of diet and lifestyle, obviously that affects men as well. And I know this is a big thing for men too, but someone has asked, and if anyone joining has any questions for Dr. Christos, then please do ask. That's what we're here for. One was around smoking. So if people are quitting smoking, which is obviously advisable for trying to conceive or having treatment and obviously pregnancy, then how soon after quitting smoking could you see a difference with eggs, sperm? Like, do you need to stop maybe 3 months before or longer? What would you normally say?
For sure, it's nothing definitive. It's not like that. I would never say to a couple, okay, now you stopped smoking. Try to avoid getting pregnant for 2 months or 3 months.
Yeah,
No,
yeah.
of course not. For the male part, we know that the full process of producing new sperms takes like 64 days, more or less. So, knowing the fact that smoking has an impact in the motility, in the quality, and the quality of the sperms, we see an improvement for sure after 60 days.
Okay.
After quitting smoking. For the female part, it's a little bit difficult to say a cutoff regarding when we will see like a better quality of eggs. But also here, we always advise not to smoke, to quit smoking from the moment that you want to get pregnant.
Mm-hmm.
Because also here, nicotine stays for a long time in the body and affects also the embryo. And if you get pregnant, also here, smoking is like a very important factor. And the nicotine, especially, and all the other ingredients that are harmful for the embryo. That is, for example, a major factor for the intrauterine growth restriction.
Yeah.
So that this means that the embryos or the babies are not capable to reach the full potential. So they are small for their gestation age.
Right. I mean, in terms of giving up alcohol and things like that, it's, I guess, obviously good all round, isn't it? But my sense of it was kind of, if I can do that, at least if the cycle doesn't work, then I'm not going to look back and regret or like think, oh, did that not happen because I didn't do that? So I'm sure you see loads of patients who just want to try lots of different things to try and optimize their success, and so that they don't beat themselves up if it doesn't work.
Exactly. And something that all the patients must have in mind is that we speak now about additional things.
Mm-hmm.
It's not like for example, if you have drunk 1 glass of wine, all of the treatment will be wasted. It's not like this. So we know that, okay, we should avoid everything what we can avoid, but it's not like a 100% thing.
Mm-hmm. Yeah. That makes complete sense. Now these ones.
And the same goes for supplements and all those things. It's not like, because one question that it's frequent asked is, for example, doctor, what supplements should I take? Okay, those are things that we need have an impact, but it's not like a game changer in the end.
Mm-hmm. Mm-hmm. Yeah, not going to make.
I don't have in my in my pocket the magical item that will solve all the problems. It's not like this.
Mm-hmm. Now, this question came from our community, but also people search for it a lot. So I'm going to ask you, and for anyone who wants to read more about any of the things that we're discussing, as I mentioned, IVF Spain, these experts at IVF Spain have written the most fantastic piece answering all of your questions. So please do head to the link in bio to read it and find out more. One question that's come up is, does masturbation cause infertility for men and for women?
No. I can reassure all they can continue to have pleasure. So it doesn't. So for females it's easier to answer this. Of course not. Masturbation doesn't play a role at all. One thing that many people have in mind when asking this question is, for example, if when the guys are masturbating,
Mm-hmm.
they will not have any sperms left. It's not like this, because the testicles, they produce constantly new sperms. And as I said before, the full process takes like 64 days. And this fact ensures that a sufficient supply of sperms is available at any time, at any given time. Now, of course, if, for example, a couple try to get pregnant, waiting few days, and I speak now about 3-4 days, it's enough. So I speak about abstaining from ejaculation. So the week before the partner ovulates, maximize in the end the sperm count during this fertile window. So this is a good approach. But coming back to your question, so masturbation is not like that. It's not possible to empty all of the sperms that are in the testicles.
Mm-hmm.
So, and also I'm sure that people have other hobbies than masturbating every minute of the day. So I think that's quite not possible.
Yeah. Thank you for clearing that one up. And the next one, which people search for a lot, which our community have asked, is there a link between sort of fertility issues and beauty products and toxins and the environment?
That's a good question. That's also a good question that I have been asked many, many times. In beauty products, but not only in beauty products, in our daily life, we have many, many, let's say, factors in beauty products. There are some endocrine disruptors. That's the name for that. It's, if I'm not mistaken, they are benzophenone, they're phthalates, they're also inside of these beauty products. And those endocrine disruptors that bind on the receptors that are normally there for the sexual hormones and can alter it, can change their response. So in these terms, they could play a role. Mm-hmm. They can alter it a little bit, the ovulation, the receptivity. So yes, but this is also something that you can find in our daily lifestyle. It's a fact, you know, that the air that we breathe, the water that we drink, the food that we eat, it's not like it's not the best. So answering this question, I would say if it's possible to minimize the use of those products, it's a good thing. Yeah. But not to use, for example, any makeup, or it's not possible, of course. And coming back to what I mentioned before, it's also not 100% thing.
Exactly. So we get lots of questions around kind of like, can women dye their hair? Can you wear nail varnish? Things like that, where sure. I guess obviously everyone wants to make sure that they're not jeopardizing anything if they're trying to conceive naturally or having fertility treatment. But yeah, it's good to hear what you say as a Western medicine expert.
Sure. I don't see any obstacles in that.
Now, another question, which I don't know if you get this a lot, but was asked, is do fertility issues run in the family?
They do. But here we must a little bit. It's you know, a general term. For example, some findings are more frequent in a family. Mm-hmm. For example, endometriosis. You can see it more often in a particular family members in a family. Then a premature ovarian failure. It's also more frequent in a family. If the mama had it, it's a higher possibility that her daughter will have it also. This term is for women who get in the menopause before of the age of 40. Mm-hmm. So it is something that we see more often. Then changes, for example, in the chromosomes can also be inherited, or in the genes. So this question is hard to answer because infertility, there are several reasons for infertility. Some of them are related with some inheritation, let's say like this. So it can be inherited. So yes.
And is that the same for men as well?
Yes, there are also some illnesses. For example, cystic fibrosis is something that could be transmittable from one generation to another, and could be a reason for that.
Yeah.
But in general, it's more frequent for the female part as it is from their male part.
Mm-hmm. My husband's infertile, and he has a genetic condition called Klinefelter syndrome, and that's a fluke thing, sorry, that happened at his conception. So that's not hereditary, but yeah, it's interesting to hear what kind of things might be, because it is something that does get asked quite a lot. And
that's the
then,
reason why it's so important for us gynecologists to do our homework, to do the one thing that we do always is during our first consultation to try to find what's the reason for us not having success, and try to ask everything. One thing that I always do before I start an IVF treatment always is to do a karyotype, a simple thing,
really,
to see inside of the chromosomes if it's an issue there. If it's an issue, okay, I know what to expect, and not to have like some surprise in the end, and waste the time of the couple, our time, their founds. So it's very, very crucial to start with a proper diagnosis and to see where could lie the problem in the end.
At IVF Spain, do you tend to do PGT a lot with your patients? Is it something that most patients have?
It depends. PGTA testing is it's a very, very useful tool, but it's more important to set the clear indication for PGTA. PGTA is not flawless. It's not like the magical tool that will guide us to success. So PGTA must have a strict indication, and then it's very helpful.
Mm-hmm.
We do it when it's necessary to be done.
Okay, so it's not
to
kind
be performed.
For everyone. It's just as and when it's kind of going to be a beneficial thing to do, dependent on.
For example, exactly. PGTA testing should have a clear indication. For example, women that are, for example, have suffered many miscarriages, implantation failures, or women who are older than 38 and have a high egg reserve.
Yeah, that makes complete sense. Someone has asked a question. Would you mind answering it, if that's okay? They've said they lost their IVF baby. I'm sorry to hear that. That was
I'm so sorry also.
a 5AA blastocyst. They ran several tests to find out if, or she had several tests to find out if she has autoimmune issues or any other fertility issues. It came up negative. So she's asking, are there any other tests to consider before trying again?
My question is, in which week did it happen?
Okay.
This is one important question to see where could lie the problem, because if it happened before of the week 12, then most likely the issue was chromosomal. So regardless of the appearance of the blastocyst.
Why is that that's going to be more common before 12 weeks and it could be some other reason after 12 weeks?
Because the embryos that don't have a normal amount of chromosomes, or major alterations in the chromosomes, are not able to implant properly, or they will not develop further than week 12 because they're not viable. Only some exceptions, like Down syndrome, like Klinefelter syndrome, are capable to develop to further stages after week 12.
Right. Okay, that makes sense. And what until what stage of gestation do you carry on seeing patients after they've had treatment with you at IVF Spain?
It depends if the patients are from abroad or if they are from Spain. So in general, all the patients are welcomed, and we would like to see them also for a longer time. But the majority of our international patients, after the confirmed pregnancy test, they get back to be treated from their gynecologists.
Yeah, that makes complete sense. Now, does anyone have any final questions for Dr. Christos? Please do ask. Are there any other things that you think that we should cover, which we haven't discussed, which come up, which you get asked a lot from patients, around things that they may have been trying to find answers for online?
I think we covered the
Yeah,
majority of those
yeah, they
questions
are good
because
questions.
they sounded very familiar.
Yeah, I'm sure.
Um,
This is
try to think.
This is a
Uh,
question that's just come in. Do you always find a cause for infertility? Obviously, there's unexplained infertility. What happens in that situation?
um, so we, it's true. It's a part that the medicine, the actually stand of the reproductive medicine is not able to find everything, but we have a responsibility towards our patients to do our homework, as I said before, and we are very happy to be able to cover a very, very large part of the cause of infertility. And if we do this investigation, we have a very high success rate. And this is also the reason why all of those patients have so high success with us.
That's really good to hear. Thank you so much. So for anyone who is contemplating treatment in Spain, Spain is one of the most popular destinations, isn't it, for treatment abroad, then please do speak to IVF Spain. I'm going to pop the link in the bio to the recent article that you guys wrote for us, which is absolutely fantastic, answering more of these or demystifying these common Google searches, and you'll find IVF Spain's contact details there to book a consultation very easily. Last question, if you don't mind, before we leave you.
Of course.
We're going back to diet, which is obviously a huge part of it. And as you said, at IVF Spain, you offer nutritional support, which I think is such a good offering. I had it whilst I was having treatment, and it really helped me kind of just guide me on what I felt, things perhaps I didn't really realize I should try. What would you suggest in terms of diet for a woman with Hashimoto disease to improve fertility?
Hashimoto disease is underfunction of the thyroid with antibodies. This is something that in many cases is related also with endometriosis.
Mm-hmm.
So we see that very, very often that they come in pair. The most efficient approach would be, of course, also here the Mediterranean diet, and also to avoid to eat food with related products with phytogen estrogens like soya, to try to avoid those things.
What about going gluten-free?
Gluten-free is helpful, but I also, in terms of doing the investigation of infertility, I check for antibodies, against antitransglutaminase and antigliadin. So if these IgG or IgM antibodies are there, then it's clear that the abstinence of gluten would be very helpful. And it's it's a very, very helpful. The solution is very easy, is to take off gluten from the diet, because we know that if a girl suffers from celiac disease, because this is the term of the problems with the gluten, and here's something else that's important. Regardless of having symptoms or not, you can have these antibodies in your blood. So, and these antibodies can be a cause of infertility because they attack the embryo that tries to implant.
Mm-hmm. Yeah.
So, gluten-free diet should be considered only for women that have like the problems with those antibodies.
Mm-hmm.
So,
is that a disease that can sometimes come about from having a C-section or from kind of scar tissue?
not really. Not really. The celiac disease has something to do more with absorption of absorption of gluten. So this can be more some autoimmune response. So some
Yeah, I meant
response of the
Hashimoto's disease. Yeah. Okay.
exactly
Got
of
you.
the immune system.
That's really interesting to hear. Thank you so much for answering that question. I'm
You're
aware
welcome.
that we've kept you for a while. We've had some other questions come through which are sort of more personalised. So I would suggest booking a consultation with IVF Spain. You can speak to Dr. Christos, who would be very, very happy to answer your questions and obviously give you personal advice, tailored advice. So again, link in bio to find out more. Read that wonderful article and have your questions answered. So thank you so much for joining me today. It was a pleasure speaking with you.
Thank you very much. Thank you very much also. It was a pleasure. And I welcome all the patients that have any questions to ask. And as you said, all the personalized questions, I'm happy to, for me or also for my colleagues, to answer them and give you another approach, maybe another direction that could be the solution of your problem.
Yeah, as I said before, Spain is a super popular choice for lots of our readers. So the link is in the bio to find out more, or you can DM IVF Spain through Instagram. So yeah, wonderful to speak to you. Thank you everyone for joining, and speak to you soon. Bye bye everyone. Bye bye. Have a good evening.